Are you worried about hantavirus? What was your reaction when you heard about an outbreak on a cruise ship in the Atlantic? Today, we're exploring how we respond to potential public health threats, why uncertainty can quickly turn into worst-case thinking, or, at the other extreme, be dismissed too easily.
We all just lived through a major pandemic, and so there's that trauma of, uh-oh, is this the start of something new? And people kind of immediately reacting to that rather than thinking, we've been dealing with outbreaks for decades, centuries. This is another outbreak.
Professor Devi Sridhar. She's a leading epidemiologist and chair of global public health at the University of Edinburgh. She's widely known for her work on pandemic preparedness, global health governance, and infectious disease policy. We'll hear more from Professor Sridhar in just a moment, but first, here's what the World Health Organization says about the hantavirus outbreak and how concerned we should actually be.
This is not COVID. The average person does not need to be worried about hantavirus here in this setting.
This is not another COVID, and the risk to the public is low.
This is not coronavirus. This is a very different virus. We know this virus. Hantaviruses have been around for quite a while.
The WHO is trying to strike a reassuring tone, but there is always some uncertainty in the early stages of a public health scare. So how do you communicate that without fueling fear? I put that to Professor Sridhar.
I think we can't be overconfident if we make statements like, this will definitely not be this, or it will definitely go like that. And I do see colleagues doing that. I worry, what if it doesn't go that way? There's always a likelihood that things aren't going through what you think is going to happen. So I guess in language, you can say, this is what's likely, this is what we know, these are different scenarios. You can lay out what is ahead, and I think that builds more trust because actually we're just telling people the facts, the information, rather than telling them actually what we think is going to happen, which could potentially be wrong, as we've learned in the past.
Let's for a moment pivot from the science of infection to the science of human behavior. We have some of the facts, but we also learned during the pandemic that those facts alone don't always guide how people react, especially when there's a lot we don't know and new information changes present guidelines. While you might think that people jump to the worst case scenarios, that's not necessarily the case.
Having talked to behavioral psychologists during COVID, one of them said actually the biggest worry when there's a fire alarm is not that everyone evacuates the building. It's that we all say, oh, it's just an alarm. So actually the biggest fear is actually us underreacting because our nature is to say, it's going to be fine. It's not a big deal. And so we do see some of that now already. People are already coming out early on and saying, oh, it's not likely to be human-to-human transmission. Well, guess what it was? Or we're not likely to see more cases. We are going to see, I think, a couple more, and potentially more. We don't know. So I think actually in some ways we have to be more worried about, let's say, understating the threat rather than overreacting, because it's better to overreact, have a really proactive response, get on top of these cases and avert a larger crisis rather than just saying, oh, it's all going to be fine.
And then there's social media, where these stories often take on a life of their own. So how much of what people see there is shaping their reaction, and who do they believe? Do people actually see the difference between the influencers and the experts?
I think people still trust science. They still trust facts. On the whole, I'm not saying, you can look at TikTok, and actually social media is full of conspiracies right now. Many of them peddled by influencers who are trying to get clicks and are trying to get followers. They're not going through accuracy and facts. So there, I do think there is increasingly a reliance on professors, on academics, on those working in labs and creating these, medical products, because they're doing it because they want to be factual, they want to be accurate, and that's kind of the work that they're doing. So I think that as much as people might, engage with social media or follow entertaining TikTok videos or, Instagram reels, in the end, when it comes to kind of reliable advice, you do see them going back to experts and asking about the facts. I think there's a difference between we have to be careful as experts not to go into predicting the future. So when I see us saying, oh, this will 100%, this case won't be hantavirus, or 100%, I'm like, we can't speak like that because that erodes trust. Most scientists I know speak in likelihoods and certainty and uncertainty. So I can say previous Hondius outbreaks have been controlled. They've all been controlled through measures such as isolation and quarantine. So is it likely we contain this one? Hopefully, yes. It's more complicated. This is why it's more complicated. We do not have a vaccine or a therapeutic. We do not have a rapid diagnostic. The incubation period makes it tricky. On the other hand, we're ahead of it. WHO's led a response. There's protocols in place. So I think we just have to lay out the facts, and then people can make their own mind up. And we have to do that without trying to be popular, without trying to play to our fans on social media, and actually just try to be accurate to the facts and to, the expertise that we've developed over many years of study.
We're still watching how this situation unfolds. The risk to the public is low, but there is still a level of uncertainty. So what should we be paying attention to? And what developments would signal a shift in risk?
I think right now we need to wait and watch. The key factor for me is right now, do we see unlinked cases to those who were on the cruise ship? Do we see onwards transmission? Do we see people who have become infected on those flights that we know individuals were on, flight attendants? Do we see when these people go back to their communities, others in the community getting infected? That would be the next, I would call, step change in response and risk. But until that happens, and that has not happened, I think right now there's not really a broad need to worry about it, beyond saying that we need to make sure our public health authorities are funded, that we continue to invest in infectious, disease surveillance, and actually why multilateralism and the WHO is so important. We need an international authority to coordinate 19 different countries or whoever it might be, and that's why it was created. And right now, I think that's why we need to kind of rely on that UN system more than ever, especially with things like, infectious disease outbreaks.
Having lived through COVID, it is easy to see a new outbreak and think, here we go again. But is that actually helpful, or can it lead us to the wrong conclusions?
Yeah, I think that our mind can easily think that every outbreak looks the same. And we think because we've lived through COVID, and that's the one most people know, that they're going to think, oh, hantavirus is going to be the same. And all I can say, I've worked on going back to, Ebola, swine flu. We've had avian flu outbreaks. We've had Zika, chikungunya I've been through, COVID, and a couple others, having worked on so many, HIV as well. If we go back a few decades, every outbreak is different. Every response will be different to that. And so you can't say just because something happened somewhere else, it'll happen again this time. So I guess that's a note of probably positivity, that just because COVID went one way doesn't mean this is going to go exactly the same way. Every outbreak is very unique. It demands its own response. But I think that would be my kind of reflection from working on this and seeing a number of different outbreaks and how different each one is and how hard it is to predict what the next one is and actually what kind of response you might need for that.
Public health scares often trigger strong reactions, shaped as much by emotion and recent experiences as by the facts themselves. We have seen that uncertainty can be misread as danger, and that both overreaction and underreaction carry risk. But we've also heard that clear communication, trust in expertise, and a better understanding of how outbreaks actually work can help us respond more calmly. In the end, it's about staying informed, thinking critically, and not letting fear get ahead of the evidence. I'm Ola Alsaka in Berlin. Thanks for watching. Until next time.